Hi, good. Thank you so much for having me here. I am Leonardo Adorno. I'm from Brazil, São Paulo, and I am a public health graduate and researcher at the University of São Paulo's Department of Environmental Health with a FAPEST bursary. I am currently working on a project focused on ecosystem service restoration and utilization to preserve the catchwaters of Sorocaba and Tietê, important catchwaters in the São Paulo state. And I have developed a card game as part of my undergraduate research card
Hmm.
game focused around the adaptation of urban cities to climate change related disasters. In one phrase, I guess I could say that my involvement with community health is constant, as
Hmm.
community health is present and should be the center point of any public health policy.
So my second question is, how is community health organized in Brazil? How visible is it? Is it well funded? What is the training people get when they do public health, community health?
Okay. So community health in Brazil is very well organized as professionals are trained in community health. And thanks to our SUS, which translates to universal health system, each basic care unit has access to professionals focused on understanding and promoting community health, which we call them community health agents. And these basic care units are organized by territory. So each territory has a specific team of just basically community health agents. And as an example of the work that these community health agents can actually perform, we have PATS, which is our program of green and healthy environments that in São Paulo trains agents of environmental promotion that bring environmental health to the community. So they promote health on a personal scale. And as an example, one of the recent activities from one of those agents that I actually got to be a part of was in a region afflicted by constant flooding. And basically, they taught people of the community about the utilization of sodium hypochlorite in order to clean their food and water before consumption after each flood. And people from that community could find this solution, this hypochlorite solution, for free at each basic care unit closest to their home.
Hmm.
So basically, we have these basic healthcare units per territory that will deal with each of those populations' problems on that territory. And of course, without the community agents, we can't actually reach the population. So they
Yeah,
are a very important part of our health system.
really interesting. Thank you very much for explaining. What have you learned in the past few years about community health, and in particular about connecting planetary health, climate justice, and community health?
So, in my experiences, what I've learned is that community health is of the utmost importance to deal with the territory's necessities. As an example, our universal health system reaches approximately 190 million people per year, and they can only reach this number through community health workers, the agents that I was talking about, which they're present at each of the healthcare units. And they sometimes, and basically these workers will go around the community and actually visit families, right? Um, and they will sometimes visit up to 400 families per month with about 20 visits per day. And this number can get higher. This
Hmm.
is kind of the mean sum we have of that number. These visits, of course, help to connect the community with the basic healthcare units as the workers tell people about upcoming health promotion events, free vaccination, and also they check up on each special patient, helping them keep up with their appointments and exams. In some regions, such as our favelas and other faraway isolated communities, these workers are one of the only and the best ways Brazil has to face these challenges.
Hmm.
And to me, at least, this situation illustrates how, in order to have good community health connected to climate justice and planetary health, we must first be able to reach individuals. We
Yeah,
need to understand their territory, and we need
yeah.
to adapt to each of those challenges.
Hmm.
So I think once there is an equity on healthcare access, then we are able to work on the universalization of healthcare itself,
Yeah.
making sure that health as a right is ensured
Hmm.
to each
And
individual.
I think you answered my next question partly already. I think what you learned about mobilizing communities.
Um, yeah, so basically on my internships as an undergraduate student and also all the different work that I've done, I think that the first step will always be to understand what the territory is actually going through, to understanding their struggles and what they find to be the more important issues they face, Something that is hammered on us in our undergraduate classes is that we need to understand and to find common interests, right? So
Yeah.
we need to understand what that community is actually facing. And I actually have a really good example about this, which are the public community gardens that we have on each of these communities, that the program of green and healthy environments supports and develops. So basically, we have a community garden called the Collective of Marys. We have a lot of different Marias there, que é o Coletivo das Marias. And they often produce organic and healthy produce without the use of agrochemicals, right? And they can be given and sold to the community. And often they have learning experiences there with kids. And then the kids get to learn about just, actually planting, gardening, and then also they get to learn and they get to take a little bit of the produce back to their home with them. So this is a
Right.
very interesting thing we have going on, and a
Yeah.
lot of different community
And
initiatives.
finally, my last question: what advice would you give to the next generation of community health workers?
I feel like I'm a part of the next generation of the community
Exactly.
health workers. I'm not as experienced as I would like to be. I know a lot of the theory, but if I could give any advice, it would be seeing community health in its current state as a newcomer. It would be to listen to your community, to spend time understanding whatever issue they face. Community health isn't only focused around the most effective policies. It's focused on helping people understand the need for help and helping people trust us so that we can help them with whatever afflicts them. We are public health workers, right? At least me and my colleagues. And our focus should be on making people feel like health is a right that they have and that they need to access it.
Leonardo, thank you very much for the interview.
It's been a pleasure. Thank you so much.